When errors happen, there's no time to hide. Here's how to report them the right way. Okay, Nurse Stephanie Victoria here. I won't bore you. I've been a nurse since 2007. I've been an educator since 2013, and I've served as Director of Health Services. So let's get right to it. I'm going to help you pass the MAP exam, which is the Medication Administration Program. I'm here in the state of Massachusetts. So just keep in mind all of the regulations that I'm telling you about are having to do with Massachusetts. But of course, in a lot of different states, it's called Meditech, Medication Aide. So the general concepts will apply, but you will look to your state for specifics. Okay. So let's talk about a medication occurrence report, a med error, simply put, right? So before we talk about what you do when you have a med error, let's just talk about how do you know you've had a med error. So do not forget that you have 6 components to a complete doctor's order, and we'll go over that. Check out my videos. And then you have 5 rights to medication. So let's review the rights. It's the right patient, the right medication, the right dose, the right frequency, meaning like time, how often you give it, and the right route. Okay, so I'll repeat that: right patient, right med, right dose, right frequency, right route. That's 5. So if any one of those are incorrect, a medication occurrence or med error has occurred. Now, it doesn't have to mean that the patient was harmed in such a way that they died or something like that, which would obviously be the worst case scenario. But no matter what, a med occurrence has occurred and you have to report it. So I'm going to give you examples. For example, if you have a patient, John, who's supposed to be given the med and you gave it to Samantha, let's say, a med occurrence has occurred, a med error, because the wrong patient got it. Now, sometimes they give you a test question where it's not that you administered to the incorrect person, but it's like, for example, if you were sitting at a table and another patient, Samantha, walked by and took the med. Do you see what I mean? You didn't give it to them, but the med was not secured in a way that allowed the wrong individual to take it. It's still a violation of the 5 rights. Okay, so that's an example of the wrong person. An example of the wrong med. Let's just say the patient has 20 meds and you just accidentally, you were working off of what you remember. Maybe you were moving fast and not taking your time and doing the med administration correctly. And you gave Tylenol at this 4 o'clock med pass when it's supposed to be 10 o'clock, right? You've worked there for 3 years. You felt like you knew it. You had it all memorized, which is wrong. That's why you're supposed to do your steps to medication administration every single time. And so you could click the link for my principles of medication administration, but you gave the wrong med. That is a med error. Wrong dose. If for some reason you did not follow the medication administration method and technique and steps, and instead of giving 1 tablet, you popped 2 tablets and you didn't catch yourself in the check, which is why you should check it again. That would be the wrong dose. Wrong frequency. If a medication is supposed to be daily, for example, 8 a.m., in the MAP world, daily signifies 8 a.m. You have, for all med times, you have an hour before and an hour after to give the medication. So meaning, if the med is supposed to be given at 8 a.m., you can go from 7 a.m. to 9 a.m. and administer the medication. So if 30, you violated the frequency because it's too early. And if it's 9:30, you violated the frequency because it's too late. So again, the MAP times, for example, for daily is 8 a.m. and you have an hour before and an hour after. Okay. And the wrong route. Route is almost like a hard one to be incorrect. I've mostly seen it be, most of them is by mouth, right? But obviously in the MAP world, Once you're MAP certified, it means that you're certified to administer medications by mouth. And when you get a job, you have to be trained to administer it in different routes. You have your ear, your eye, intranasal, sublingual, topical, which is ointment, suppository, enema, G-tube, all these varieties. And I'll have a video about the medication routes. So what I've seen people do, for example, people might mess up if you're supposed to get someone has an infection and they're supposed to get ointment in the left eye only. They end up putting it in the right eye. Okay. I've seen topical where the route is correct, but the location's not correct. So I've seen that happen. And so sometimes you don't see a med error pertaining to route as frequently as you see dose or time. I would say out of all of them, time is the biggest one that I see. Someone missed a med. They just didn't do their med pass. Okay. So now that we did a little overview of what a medication occurrence is or a med error, it's a violation of the 5 rights: the right patient, right med, right dose, right frequency, right route. Let's talk about kind of the seriousness of it. So say you forgot to you gave someone their Colace an hour late. Colace is a stool softener, right? Is it a med error? Yes. Do you still report it? Yes. Has the whole world fallen apart and the patient become violently ill for getting their Colace 1 hour late? I don't believe so. Okay. So it shows you that there's different degrees. If you forget to give a patient a medication called Coumadin, and it's an anticoagulant, meaning if they have blood clots, it helps their blood from clotting. Because no one gave them that med for 5 days, they had a huge stroke and they died, right? You can see that this is a significantly different scenario from the Colace stool softener to the Coumadin anticoagulant. Okay. So the ripping is not going to be the same because the repercussions are not the same. So one, you want to find out if the patient's okay. So the patient is the center of everything. You come in as staff and you go to give your meds, you realize a med wasn't given. Your patient, hopefully you've laid eyes on your patient, you go visualize the patient is okay. So that is the first step. Now, say if the patient was not okay, most people in healthcare also have CPR, first aid, or basic life support. So you'll be able to tell if it's a 911 emergency situation. Usually in our group homes, if someone has fallen and hit their head, is 911. And then in healthcare is airway, breathing, circulation. If any of those things are wrong, so any reason you call 911. So obviously you're going to call 911 before you notify the supervisor, right? Because it has to be centered around the patient. So you check the patient is okay. The patient either is okay or they're not okay, and you would handle that appropriately. Okay, so let's table the 911 example and put it off to the side for a moment. Let's say the patient, you forgot the stool softener and they're constipated, but they're okay. So the next step, they don't need 911 because of that. You call the MAP consultant. I have videos about when to call the MAP consultant. The MAP consultant is there for clinical judgment. Remember, you as a certified MAP staff, you do not know everything there is to know, right? In a certificate program, that's 20 hours. So you need someone with more experience to come and provide you clinical judgment. So you call the MAP consultant and ask them what to do. You then notify the supervisor, all right? You would then document on the medication occurrence record or medication occurrence report. I'll insert a picture, and so you could document that. They have, if the person is okay and it wasn't a hotline situation, the 911 is a hotline situation. So remember, we said we're tabling that for now. If it was not a hotline situation, you then have, or the supervisor, whatever the steps are for the house, there's 7 days to get that MOR, the medication occurrence report, to the MAP coordinator. Okay. And that's the step. So let's review. In a medication error, okay, or medication occurrence, it's a violation when one of the 5 rights have gone wrong. If the patient is okay, this is the order that you follow. You first check the patient because they're priority. You determine that it's not 911 and they're technically okay. All right. You have to then call the MAP consultant and follow whatever direction the MAP consultant gives you. You then notify the supervisor, and all of this you're documenting. You notify the supervisor. You then document on the MOR, the medication occurrence record, and that medication occurrence record has 7 days to get to the MAP coordinator. So that's what they would look like. Now, let's say if the worst comes to worst, whatever error occurred is more severe, and the patient, you have to call 911. So again, you check on the patient because they're first. You determine that 911 has to be called. You call 911, and with that, there's staffing issues. A lot of times a staff has to go in the ambulance or follow the ambulance, but you call 911. You call the MAP consultant, right? You call the supervisor. This is called a hotline occurrence. If there's illness, injury, death, it's more severe. It's called a hotline occurrence, okay? And so with that, when you fill out the MOR, the medication occurrence record, you have 24 hours to get that information to DPH, Department of Public Health. So you see it's different from the 7 days. The 7 days has to go to the MAP coordinator, but this one, 24 hours, it has to go to Department of Public Health. So that was all having to do with medication occurrence. Hopefully that does not happen. Click the link below. We have some questions that you can answer to help you pass your exams. And good luck. Don't forget to be essential. And we would love it if you give us a like and subscribe. All right, take care. Bye.